Hello, everyone. We've reached the top of the hour, but people are still joining, so we'll get started in just a minute. Thank you. Good afternoon, everyone. We'll be starting in just a minute, just allowing people to be able to join the platform. Thank you so much for being here. Okay, we're going to go ahead and get started. So first and foremost, welcome everyone to today's event. My name is Liz McClune and I lead Project Firstline for CDC. But before we get started, I want to take a moment and thank you for being here. Your time is valuable, your schedules are busy, and you chose to spend some of it with us today. And that means a lot to us, and we're really grateful for each and every one of you. Our hope today is to do a couple things. One is to take a moment and thank you, not just for being here today, which is no small thing, like I said, but for everything you've done throughout the past few years and each and every day as you show up to work to care for patients. It's an important thing. It sometimes, especially to patients, feels like a heroic thing, and you do it incredibly well. And often, I'm sure, feel that you don't get thanked enough. And so let me start by thanking you, but I'm not the only one who's here to do that. We have a great 30 or 40 minutes for you today, but we wanted to spend time and give some time back to you to be able to explore our resources for yourself. So in addition to thanking you, we're going to show some of the new resources for infection control training and education that we have made just for you with healthcare workers like yourselves. And then we're going to give you back some of the rest of your day where you can explore for yourself, but also engage with us on social media. And we hope it's the beginning of a conversation that you have with us at Project Firstline and a long-term relationship as well. So here, we're going to go ahead and get started. I'd like to introduce someone who wishes she could be here today. We can go to the next slide, Tabia, no worries. Who wishes she could be here today to thank you live and in person, but wanted to make sure that she expressed her thanks and gratitude to you for being here and for your service. So I'm going to pause for a second and let our CDC director, Dr. Rochelle Walensky, speak for herself as she expresses her personal thanks.
It's my pleasure to join you in celebrating Project Firstline, a program that celebrates the diversity of our healthcare workforce and recognizes the important role each of you plays in making healthcare safer for everyone. No one has faced the harsh realities of the pandemic in the same way as healthcare workers on the front lines. I'm guessing each of you remembers the moment COVID-19 first touched your life. For me, it was about 10 a.m. Friday, March 6th, 2020. At the time, I was the chief of the Division of Infectious Diseases at Massachusetts General Hospital, and my pager went off, alerting me that we had the first case of COVID-19, indeed cases, in Massachusetts. From there, everything changed as we immediately moved to protect our patients, their families, and our staff, with infection control measures at the top of the list. Indeed, COVID-19 made it even clearer that infection control is the responsibility of every healthcare worker. Project Firstline is here to support you in building and maintaining a strong culture of infection control in your workplace. Your time is valuable, so these resources were created with your diverse learning and educational preferences in mind. Project Firstline's educational materials, including videos, interactive modules, infographics, mobile content, and screensavers, are designed to help all healthcare workers protect patients and save lives. I know that the trauma of the past 2 years will have a lasting impact, not just on our communities, but also on our healthcare workforce. Please, while taking care of others, do not neglect yourselves. Thank you for your ongoing strength, perseverance, and commitment to your patients. Thank you for your countless sacrifices you have made over the past 2 years and continue to make, and for the countless lives you have saved. We at CDC are here to support your infection control training needs. Together, we have the power to stop infections in healthcare.
My thanks to Dr. Walensky for providing those remarks, and can't reiterate enough her sentiments. I know the last 2 years has made an indelible mark on all of us, but particularly the healthcare workforce. And our hope is to learn from it and to continue to support you during the pandemic and moving forward as well. And now I'd like to introduce another special guest that's here with us today, Dr. Denise Cardo, who's the Director of the Division of Healthcare Quality Promotion here at CDC. Dr. Cardo joined CDC in 1993 as a medical epidemiologist. After holding several leadership positions in DHQP, she was selected as our division director in 2003. She leads activities to prevent infections and antibiotic resistance in healthcare settings and to promote healthcare safety. She's also been involved in several CDC emergency responses for emerging infection threats, including the most recent one for SARS-CoV-2. Dr. Cardo has been involved in healthcare epidemiology and hospital infections for several decades and is internationally recognized as an expert and leader in the area. Her interests and passions include patient safety, the prevention of healthcare-associated infections, antibiotic resistance, sepsis, and the interaction between public health and healthcare. It's my honor to introduce her today. Dr. Cardo?
Thank you, Liz. And it is my honor to be here today to join our director, Dr. Walensky, in thanking all of you for your work and your commitment to promote patient safety, to infection control, even during very, very challenging times. As Dr. Walensky said, the COVID pandemic has had an impact in all of us. We all remember when we first got involved. But for the ones like you working in healthcare, it has been even more challenging. And how even sometimes to put your health at risk while protecting patients. And not just your health, but your family. So your work has been the main reason we are able to continue to prevent infections in healthcare and really move towards a better time. Regardless of your title or of what your role, your activity in healthcare, all of you play a very, very important role in infection control. Sometimes we think that only when we're taking care of patients is that we play a role, but that's not the case. Doesn't matter if you're taking care of a patient, inserting a line, if you are doing a procedure, if you're cleaning the room, if you are working in the ER, it doesn't matter where you work and what you do, you have a critical role. And that's the reason we decided to have this project, that to really provide tools and ways to empower you, not only to know what you need to do, but also to understand why it's important to do it and how you can get it done. It's not just another training in education. It goes beyond that. We want Project Firstline to be integrated in everything we do in healthcare. A way to facilitate that all of you can follow infection control practices that will promote patient safety, but also protect yourselves. And that's the reason, like Lise said, it's really working together and creating tailored materials with your input and always improving so it can really be helpful for you to do everything you can to prevent infections to patients and to yourselves. And thank you again very, very much for everything you do and for joining us today. It's amazing when I look at the number of people. It's amazing, not only that you're taking your time, but that you are interested in really doing better. Thank you. And now I turn back to Liz.
Thank you, Dr. Cardo, and can't say it enough. Yes, the passion that you show for improving patient safety and improving infection control is mind-blowing, and we're so grateful you're here. I now want to turn it over to another special guest, Dr. Michael Bell. Dr. Bell is a deputy director at the Division for Healthcare Quality Promotion for CDC. He's spent his career focusing on investigating and preventing the transmission of healthcare-associated illnesses and providing evidence-based infection control guidelines and education. He received his medical degree from the University of Washington and trained in infectious diseases at the University of California, San Francisco. Dr. Bell, it's a pleasure of having you here today.
Here I am. Thanks, Liz. Welcome, everybody. Thank you again for being here. I think that the fact that you've joined it all is incredibly exciting to us, especially in the midst of so much work. So thank you for prioritizing this. I think it goes without saying that we all recognize the importance of making sure that both we, our colleagues, and our patients are safe, minute by minute, hour by hour, anywhere in the healthcare system. And our healthcare system is huge. The number of people involved in making sure that a patient manages to come in and leave safely for their care is tremendous. And it's something that I don't think most people recognize. One thing that I want to say, in addition to the thank yous that you've already heard, and certainly thank you very much, is to understand the stress and frustration that we've all felt over the past 2 years. It's been a miserable couple of years. Unfortunately, it's not over yet. We are now in the middle of trying to figure out what to do with decreasing numbers of staff, people burning out. Now more than ever, having the right information to know what to do and how to do it is going to be key. I think many of you are going to be engaged in helping new staff members understand what to do and how to do it. And to do that, I think it helps to have convenient information. So pivoting now to Project Firstline, this is a program that was designed for all healthcare personnel. Traditionally, a lot of healthcare information has been delivered to nurses and doctors, and that's fine. But most of us don't have the time to spend an hour looking at slides. Many of us don't have the opportunity to hear talks and lectures. And so making sure that we're able to bring the information that you need to where you are when you need it is really the thrust of Project Firstline. one of the overarching themes that I hope you'll see, and I do hope you use this stuff. There's a tremendous amount of exciting stuff that Liz will describe in a moment. But one of the things that I think you'll notice is there's a great deal of attention on why we recommend something, why you're supposed to do something. Through the years, we've all been given long lists of rules. You always have to do this, you always have to wear that. And those are okay, but they get confusing when you've got different sets of rules for different things. And so we have focused a lot on understanding why those rules exist. I think when we understand why something is done, it becomes much easier to know when to do it. The other piece that I want to bring your attention towards is the idea of being able to recognize when there might be a problem. Oftentimes we are directed by signs or like I said, lists that tell us what we're supposed to do. But there's a whole other side of patient safety, occupational safety, that's really about noticing something that could be dangerous. Something that could be dangerous to us, like a sharp that's not covered or disposed of properly, or that there's a trip hazard for a patient because of an IV pole or something. When we notice something like that and do something about it, we can stop a problem before it starts. Infection control is the same. So in addition to understanding the why behind what we recommend, there's going to be a lot of focus on being able to notice where a problem might be so that we can do something about it before it gets bad. So in a nutshell, lots of information, a lot of it dedicated towards quick learning and convenience for all of us who want to see something, want to know something, but may not have an hour to spend doing it. With that in mind, we look forward to your trying our stuff, and more importantly, getting your feedback. If there's stuff that you need that we're not providing yet, if there are ways that you think it would be more helpful to deliver, please let us know. We're here to make things better for all of us in healthcare. And the more we hear from you, the better. One more thank you to all of you for taking time today, not to mention the work that you've done for the past 2 years. Truly tremendous and much appreciated by everyone. So with that, thank you, and back to you, Liz.
Mike, and if you can remember one thing, check out our stuff, I think is hopefully easy enough to remember. I want to go now and provide just a quick synopsis of who we are. If you got here through connection through a colleague or a partner, you may not know what Project Firstline is or who we are. And we won't take much time on it, I promise. The first thing to note is that we are at its heart a collaborative. We know here at CDC that we can't do it alone and we don't want to. In order to prevent the spread of infections in healthcare, it takes everyone from public health to clinical health and everyone in a facility to know what to do, but also why they're doing it. And that takes a lot of work and collaboration. And we really, at our essence, have strived to do that and will continue to do so. We strive to provide infection control training and education that's a little different. It's grounded at its heart, yes, of course, on the infection control recommendations and guidance that our colleagues here in the division work to develop and the science that informs them, but also on adult learning expertise, educational best practices, and first and foremost, your learning needs and preferences. And we're talking about a workforce that's over 20 million strong. So when we talk about learning needs and preferences, there's not just one, but our goal is to meet you where you're at. And that means being in a lot of different places and working with a lot of partners to make sure that we understand your needs and preferences and that we can continue to strive to meet them. So what that meant for us, next slide, please, is that we wanted to spend the first year almost exclusively listening. And that is something that we will continue to do throughout our existence. We understood the first year of our existence, we're only 2 years old, that the thrust of need and information was on just-in-time information related to SARS-CoV-2 and the guidelines related to COVID-19 in healthcare. That makes total sense. And so we also recognized and heard from you that your free time, and I put that in quotes, was getting shorter and shorter and shorter, and that you needed information that was coming to you. You didn't have time to explore websites and try to find it. And so you'll see if you check out our website that there's a whole section about quick videos and bite-sized information related to SARS-CoV-2 and COVID-19. And that was really to make sure that we were providing the emergency communication that you needed. But we wanted to understand more broadly when it came to infection control, education, and training. What was your need? Was the content out there meeting it? And how could we better support you? And we heard a lot of themes that I'm sure are no surprise to you because we were hearing it from your colleagues. One is that you wanted in the content that you were receiving a message that there was value in every healthcare worker and that there was value in the role they play in infection control. And we couldn't agree more. We also needed to be responsive to the fact that your bandwidth is low, getting lower every day, that there's certainly burnout and trauma related to the pandemic. And so what you asked for was bite-sized content that was tailored and applied for practice, and that could be used on the go throughout the workday. You didn't have time to spend an hour, as Dr. Bell said, looking through slides. But more importantly, that the framing of infection control education and content was so important to you. Often what we heard is that infection control education had been framed as a list of rules and policies and regulations, and that seemed antithetical to the empathetic work that you do every day to care for patients and help them heal. But what we know is that infection control is how you help someone heal, how you care for someone. And so we needed to reframe how we talked about infection control to make sure that we were really bringing that to the fore and tapping into your motivation for why you get up every morning and come to work, or every evening and come to work. We also heard loud and clear that, hey, we have existing strengths, we know things, and we couldn't agree more. So our hope is that our content builds off of those strengths, celebrates the strengths you have, and applies them to infection control. And then finally, we heard loud and clear that we're often told to do things in the Nike just do it approach, but we really want to understand why we're doing it so that we feel more empowered that when our workday takes a turn, we know how to respond and still provide safe care for ourselves, our patients, and our colleagues. So, like I said, we can't do all of that by ourselves, nor would we be successful or want to. So this is our Project Firstline partners. They expand even farther, but our primary partners here are listed, hopefully reflects the true diversity of the healthcare workforce. And we're adding more partners every day from folks that are working in pediatrics to long-term care, to health systems, to nurses, to doctors, to health systems themselves. We also have engaged our public health and tribal healthcare colleagues because we want to make sure that we continue to understand the diverse needs and that we're speaking to people directly. And so this continues to grow, but I want to take a moment and thank everyone on the screen and those who have been part of the collaborative. We're here because of you and we thank you. So now we're going to move on and for the main event and start to explore a sampling of our new resources. If I were to show you everything we had created, you'd be here for hours and you don't have time for that. As Mike said, our goal with this curriculum, which is just beginning, this isn't the end of the content you'll see from Project Firstline, indeed, it's just the beginning, is to help you and support you in identifying infection risks like you do fall risk, medication errors, and the like, and apply it to infection control for yourself, but also to embrace the fact that healthcare is different, it's unique. And while infection control has kind of become a popular jargon in the community because of COVID-19, healthcare is different. And there's a reason why we do things differently, why our guidance is often different, and that's okay, and that there's a reason for that. So we have a sampling of our overview video. It's much longer, and so I really welcome you to check it out, the whole thing. But I'm going to pause now so you can get a sampling of that overview video.
You deal with risks every day at work. Think about times when you're mopping up a spill, checking a medicine dose, or when you see a wobbly patient about to fall. You see a possible problem that could hurt a patient, and you take action. You can use this same process of recognizing risk when it comes to infection control in healthcare. If you learn to spot the opportunities for germs to spread, then you can step in and take action to stop the spread of germs. So why are we so focused on germs in healthcare? The risk for germs to spread is different than it is at home and in the community. There's a higher chance for germs to spread in healthcare settings than, for example, a grocery store, because it's where patients who are sick come for care, and patients who are already weak or ill are likely to be more vulnerable to infection. Healthcare is also unique because some of the things healthcare workers do as part of giving care can put patients at risk of infection, like starting an IV. Sometimes we are the opportunities for germs to spread. We interact with a lot of people throughout the day. We touch a lot of things, and we use many different kinds of equipment. And these are all ways we can spread germs. All of this is why we have to think about infection control in healthcare differently than we think about infection control in the community.
So again, that's a sampling of our overview video. It goes on to talk about how to identify infection risk using reservoirs, so where germs live in the body and in the environment, and we'll get into that in a second. But I want to turn now to the full suite of educational resources and the types of things you'll be able to find on our website and potentially on partner websites as well. So the first thing I'll note is that we decided with our new material, after listening to healthcare workers like yourself, that it was important to use every piece of real estate to teach and to educate, and not just to present material and information. So we've transformed our website into a teaching tool. When you engage in the different web pages related to learning more about infection control in healthcare, it will be as if our infection control experts are speaking directly to you, explaining how to identify infection risks, but then pointing you to the different resources that can help reinforce that information, teach further, help you to explore it. And so really hope that you're able to check it out. And again, it's our hope is that it feels like an experience of being able to talk to a CDC SME whenever you're available. And I think if you'll agree, they're pretty beautiful too. Next slide, please. We also wanted to create interactive, gamified opportunities where you can not just think through the order of things that you often do in healthcare, but why, and how does it impact whether you're able to spread germs or potentially prevent the spread of germs, which is why we're all here. So these are a sampling of the two. I wish I could play it with you live, but really encourage you to check it out. There's two, and we'll be rolling out more over the next month or so. One involves a scenario that often might seem common to most of you, where you go to change the linens and you notice something that you didn't expect to be there, diarrhea. And what do you do, and what does that mean for infection control? And then the other, for those of us who work in pediatrics or those who have worked with an inpatient adult patient like myself, is you're going along, you're doing the steps in the order, and then you notice that your patient trips you up, throws in a monkey wrench, and you have to go, how do I move on from here in a way that still provides safe care? So our dear friend Fidgeting Felix invites you to check him out as well. Next slide. We also know that many of you, whether it's part of your job description or whether it's become part of your job description unofficially, find yourself in the role as educator and trainer and teacher to your staff and to your colleagues, or maybe that's your formal role. And we know that that's probably not the only hat you're wearing during the workday. And so we've created a suite of training toolkits that provide scripts, PowerPoints, activities, fact sheets that you can help to teach this to others. And it's ready right out of the box. So if you were told this morning, hey, we need you to train your staff in X, and you came to our CDC Project Firstline website, you'd be able to find those materials and use them right out of the box. We hope you explore them. I'm really meant to support you as you support others. Next slide, please. And then we also heard loud and clear that oftentimes infection control training and education takes the form of modules that you have to take at the end of the year. And sometimes that makes it feel like it's not important and it's not integrated as part of patient care. And we hear you. So what we wanted to do, in addition to providing formal learning opportunities, is to utilize posters that are engaging, fun to look at, but also can be posted by where you check to see if your PTO got approved, while you wait for your 7th cup of coffee, or heck, while you're in a bathroom stall and you have a few minutes to think, and use that not just to promote ourselves, but to provide educational material as well. That's fun to look at and engaging to look at, and will remind you that there are germs in healthcare and that you play a role in helping to keep people safe. Next slide, please. We also totally recognize that when you have an educational curriculum that has the word reservoir as one of the most common terms, we might need to do some explaining of what we're talking about and really breaking that down. And so for us here at Project Firstline, we see the primary places for germs to live as being on the body, in the skin, the respiratory system, the gut, and the blood, and in the environment. And I'll get to that in a second. And we wanted to provide a one-stop shop where for each reservoir where you can find germs, we described certainly where's the risk, the germs that are often there that of course you can't see, the tasks that you do every day that engage that reservoir, but most importantly, the infection control actions that stop spread, so that you have all the information you need in one fact sheet to not just learn more, but feel empowered to take action. So these are the 4 we have for the body, which can be the patient, you, your colleague, a visitor, but also the healthcare environment, which is on the next slide, which are the devices that we use every day in healthcare, dust and dirt that often gets created when there's construction, even small projects in healthcare, water and wet surfaces, and dry surfaces as well. So really invite you to check those out. Next slide. We also heard loud and clear, and I agree, one of the primary challenges with stopping the spread of germs anywhere, but in healthcare to be sure, is that you're trying to stop the spread of something you can't see. And so you often don't get that immediate feedback of transmission events because infections take a while to develop anyway. And it's hard when you're moving fast, you have a lot on your mind, and you have a lot of responsibility to keep to the front of mind that even though you can't see it, germs are present. So we've created a whole suite of beautiful animated GIFs for us to bring to the top of mind that germs are on these reservoirs like your skin, that they're engaged in the actions that you take every day, and that you can do something to stop their spread. Next slide, please. And then we also recognize that you are like us, you're on social media every day, you're probably on Facebook before this, you'll be on Twitter after, and we want to be there too. So we're highlighting those platforms for teaching. And so I'm going to pause while you see a topic teaser that you can use and post on social media. So again, we have dozens of different pieces of social media that you can use straight out of the box to share with your colleagues and learn a little something too. And one of the things I want to really highlight about this new approach is that our goal is for these materials at the beginning to be somewhat setting agnostic. Identifying infection risks can happen in long-term care, in acute care, outpatient, dental. Knowing where germs live and knowing how they spread and what you can do to stop them is something that can be applied to any healthcare setting. But we also know that you are often the experts of your own setting and your own workflow. And so these are right for adaptation to your setting and into your workflow and to your workforce as well. And we thank our partners as well for being integral in that adaptation process. So I know that I've talked a lot and you don't know who I am, and you're often here because of the partners, the organizations that you belong to. And so they've actually worked together, our Project Firstline Collaborative, to send some messages to you. So I'm going to pause and let our wonderful Project Firstline partners speak for themselves.
The experience with Project Firstline has been a wonderful opportunity for NMPHI. It's allowed us to build the capacity of our membership and our network, and it's allowed to strengthen relationships that we had with our other public health partners and create new relationships with healthcare and stronger collaboratives. I think without Project Firstline, I don't know if these partnerships would be as strong as they are now or as collaborative as they are now. It's definitely given us the opportunities to hear from a variety of different professionals on their experience around infection prevention and control. And it's given us an opportunity to be innovative in the way we train and the way we teach the workforce on this important topic.
With 1 in 3 members of our community that are limited English proficient, I think it is our job to eliminate those barriers. And with the help of Project Firstline, we can train folks and give them the key principles that they need in the languages that they speak.
One highlight of our experience with Project Firstline is that we were able to provide job-specific training on infection control for tribal emergency medicine and dental teams. Early in the project, professionals working in these roles expressed the need for infection control training focused on their fields, particularly in response to the pandemic.
New delivery methods, so using augmented reality, using extended reality, using artificial intelligence to create access to platforms for facilities that otherwise can't afford it, don't know how to use it, and would never be able to develop it. And that in and of itself will really advance the capability of frontline infection control practitioners and healthcare personnel to advance knowledge, advance practice, improve outcomes. And that wouldn't be possible without the Project Firstline initiative.
Our experience with Project Firstline has been super important to our organization because it helps give frontline nurses a voice. Their voice is full of insight into their work practices and how we can improve their work environment to increase the quality of patient care and the well-being of nurses.
Having the opportunity to work on Project Firstline has been a great experience. Knowing that our organizations are able to make a meaningful impact on the people who are serving on the front lines is so rewarding.
So what I'm most excited about with the new materials is really, I guess, a couple of things. It's continuing the messaging or the approach that Project Firstline has had for their content, but spreading it so much deeper. And so what I mean by that is really supporting the full team, the full healthcare workforce with understanding the why.
What excites me most about the new materials is that I think it's really responsive to the needs of the audience. We've spent a lot of time in this first year hearing from healthcare professionals what they need and what they're looking for. I think we know that they're all really busy, they're exhausted, and this content is being designed to meet them where they are with the limited time that they have. We know that understanding where germs live, where they thrive, both in the body and in the environment is going to be really important to keeping people from getting sick.
What is exciting is the variety of products available to promote the new content that allow for active and passive learning, which will allow healthcare workers to choose how they receive information and can learn on the go.
Infection control practices are the core for quality and safe nursing care. And infection control education helps to safeguard both nurses and patients. It also helps to lower the risk of hospital-associated infections, and it also improves patient outcomes.
COVID-19 really revealed critical opportunities to improve infection control in a variety of settings, and local health departments demonstrated a willingness to meet this challenge head-on. And it's really important that they are provided with the training and resources to be successful.
Ongoing infection prevention and control is really critical to ensure that pediatric healthcare providers are kept up to date with the latest guidance and recommendations. And the education really needs to be released in a variety of formats to meet where our members' needs are. So I think at the AAP, we've really been trying to evaluate all of our efforts and adapt our methods to really ensure that we're meeting the providers where they're at.
Our audience is diverse and it ranges from leaders, managers, staff, residents, families, and other visitors who enter into the building. Our goal is to provide education that engages our audiences in becoming part of the solution to reduce infection and the spread of germs.
Training is extremely important because healthcare workers are really dedicated individuals and they're laser focused on saving patients. And so because of that, they can sometimes neglect their own safety when they're in the moment. And so training can help some of the IPC practices, infection prevention and control practices, become second nature or instinctual. And so this can protect their own well-being as a result.
Infection control is one of the most powerful tools we have at our disposal to protect patients and healthcare personnel. And if you think about some of the most basic infection prevention tools we have, hand hygiene, we know that the simple act of hand hygiene can prevent transmission of infections in healthcare. But it's not only powerful, it's empowering. It impacts every person who works in healthcare, every patient, every visitor who comes to our facilities. So improving infection prevention and control education for healthcare personnel can improve the care of our patients and the safety of our facilities.
Thanks to our partners for participating in that video and putting it all together. I hope that you see just the breadth of different settings and professions that were reflected there. And I also want to highlight the fact that content is being adapted and produced by the whole collaborative all the time. So I invite you certainly to check out our new materials that were launched just yesterday at cdc.gov/Project Firstline, but to also engage with the partners that you've heard from today. They're always working with us to make accurate and engaging infection control content for pediatrics, for long-term care, for a variety of other settings. And we continue to work on increasing that partner base and increasing our reach so that people can see themselves in our materials, from our fantastic EMS providers to dental and beyond. Again, our materials that we released just yesterday are meant to apply to all professions and all roles, but we know the importance of being able to see yourself and hear your voice. And so we're working to continue to meet that goal, which is a goal that won't go away, and we don't want it to. I also want to note, I think we have gotten some questions about whether this presentation will be recorded. It is, and we'll work to disseminate it as quickly as we can. We want to make sure that it's accessible for all of our audience. And so we'll work on getting that out to folks who weren't able to join us today. And I'm sure you'll be a big part of sending that out. I know that right now your time is short and you've spent a lot of time listening to me and listening to our partners and to Dr. Walensky, Cardo, and Bell, but I can't reiterate again how grateful I am that you spent over 40 minutes of your day. And I want to give the extra bolus of the time for the hour back for you to go onto our website, click around, explore, and then shoot us a line on social media so that we can see how you feel about these pieces of content, this stuff, and ways that we can continue to support you in the future. We are a program that is focused on making sure that we're meeting your training and education needs for infection control. And we know that that is a mission that will continue on. So thank you again for being here today. Thank you for your questions. I hope I've addressed most, if not all, but you're of course welcome to engage us on social media to talk further. Thank you to our partners. But all in all, thank you to you for the things you do every day to take care of your patients, your colleagues, and yourself. I hope everyone has a great day.